For more on this, we are now joined by Dr. Zoleka Ntondini, the Director of Animal Health at the Eastern Cape Department of Agriculture and Rural Development, on how the outbreak may have an impact on the export of pigs from the province. Dr. Zoleka, thank you so much for joining us here on the late edition. This is certainly, some devastating news coming out of your province, especially looking at how it will impact small-scale farmers.
That is very correct. It will impact small-scale farmers, especially for their production. Small-scale farmers do not necessarily export, but we do have big enterprises that may have an appetite for the export market. Those big enterprises, we are encouraging them to register as compartments so that they can then introduce strict biosecurity measures, and that would allow them to export based on the import permit of that exporting country.
And Dr. Zoleka, maybe if we can take a step back and if you can just give us a bit of more information in terms of how and when this latest outbreak was actually detected.
This outbreak, we started seeing deaths in pigs in Port Elizabeth as far back as April. And we then picked up another outbreak at Makana, and then there was another small-scale farmer in Batawe in the Mama municipality. Those are the reported outbreaks that we have seen in the province recently. However, remember the outbreak in the province came in 2019 when we first received this outbreak.
And as a department, how would you say that you are responding to the latest outbreak?
We are currently conducting awareness and training of farmers. We are encouraging our farmers to also apply within the department to undergo extensive training on pig production as the department offers a farmer training. We are also doing awareness to control the spread of the disease in terms of advising the farmers to enclose their pigs as well as avoid taking pig products out of their villages, because that's how the virus spreads.
And Dr. Zoleka, we've seen a few of some of those small-scale farmers. I'm sure you have actually spoken to those who have been affected. They must really, be devastated by this.
They are devastated, Mbali, especially because as a province we were once hit by a classical swine fever, which is a different disease to the African swine fever that we currently have. They may look alike, but it's not the same disease. Classical swine fever is a foreign disease that we don't have in South Africa. And then the department had to cull the pigs. But now African swine fever, on the other hand, it's a disease that we've always had in the country, even though it was in the controlled areas around Mpumalanga and Limpopo and some parts of KwaZulu-Natal. It's new that it has spread extensively in the whole country. As I'm saying, we only started experiencing it as the Eastern Cape in 2019. So it's really very devastating for the farmers, but the department is currently not going to cull the pigs, but we are advising strict biosecurity that they must keep their pigs inside. The farmers have, when I was interacting with them, they have expressed their fear that when the disease arrives, as they have seen in the past, in the recent past, the pigs, they literally die. Once they get sick, they die. So for them, they would rather salvage their pigs before they even get the disease. And those that are due for slaughter, then they're slaughtering those.
And maybe you can just give us a bit of insight in terms of, those who may try and detect or, and try and see some of the characteristics of this swine fever. Maybe tell us, how do you know if your pigs have contracted swine fever?
Okay, yes. The common symptoms would be high fever. Once the pig gets high fever, then it stops eating. It does not want to eat. And then you will find that it gets in coordination of the gait. The movement of the pig becomes uncoordinated. They may get discoloration of the skin, the abdomen and the feet, and then they die. It's a very quick disease in terms of clinical signs. And once it shows clinical signs, then possibilities are that it will then die. The farmers that I've interacted with have actually said that some of their pigs, they see them today, it's not fine, tomorrow it's dead. So it's a very quick disease in terms of killing the pigs.
And just lastly, maybe if you can just give us a bit of information on that as well. We know that there is no vaccine, for this swine fever. Perhaps if you can just give us an insight in terms of the investigations and the testings being done to try and help, those farmers, some form of vaccine that can help farmers. Do we know how far maybe, the South African government is in terms of trying to find a vaccine for swine fever?
But the vaccine, it's not that it's not in South Africa. It's just not there in the world. The disease does not have a vaccine at the moment. Yes, we've had interaction with some of the pharmaceutical companies to find if the strides that are being done from their side to get this vaccine, or to try and do the research as you are saying. However, it's still early days. We have not been told of any pharmaceutical company that is actually in the process of developing a vaccine. So the best way of making sure that the farmer does not get the disease is to just up their biosecurity control and ensure that they keep their pigs safe in an enclosed pen and avoid getting people inside the piggery pens.
All right, Dr. Zoleka Ntondini, thank you so much for your time here on The Late Edition. That is Dr. Zoleka Ntondini, the Director of Animal Health within the Eastern Cape Department of Rural Development.